right? That causes a lot of injury. So we got the structure, the bones, all movement happen at a joint from muscles and bones. All right. So we got the clavicle, we got the scapula. Everybody's heard the rotator cuff. You got four muscles that really attach that ball to the socket. So anything can go wrong with the shoulder joint. That ball can come out. Now you got a dislocated shoulder. All right. A lot of people will say, I have a separated shoulder. What's the difference between a separated shoulder and a dislocated shoulder? They are different. All right. Different bones. You still got the scapula because that's where the ball and socket attaches, right? But on a dislocated shoulder, you got that clavicle that also attaches to the scapula. And if that comes apart, then you have a separated shoulder. Tony Romo, football player, quarterback, fell on his shoulder, dislocated it, okay? The ball and socket didn't come out, that's dislocated, he separated it. So that bone there. So if you're having shoulder pain, we gotta address what kind of pain is it, all right? The other part to all of this is the emotional part. Women tend to have more shoulder pain than men. Responsibilities is what I've seen over the time. If you're a person that's burdened by responsibilities, depression, everything is big, it's going to weigh on your shoulders. That shoulder pain, it's no joke. There's a correlation. You get rid of the stuff that's weighing you down, responsibilities, your shoulders start to feel better, even though you haven't done anything. All right. So here's living well balanced. You get on the table, you got shoulder pain. We're going to do an assessment. We're going to try and figure out what's causing the pain, and it can be a host of things. Some of the things that people forget about with shoulder pain is that we have a rib cage, right? Your rib cage is way up there, all right? The clavicle and the first rib, they're almost on top of each other. If the muscles in your neck are really, really tight, they can squeeze on those nerves that's coming out to that area, and you have what you call a trigger point, shoot pain to the shoulder, and it's a mess. So all I can say to you, if you're having shoulder pain, come to Living Well Balanced. We'll address it from a chiropractic standpoint, from a massage point. And the one that we really miss is the strengthening. I can't strengthen your muscles in an hour on the table. I can release some tension, but I could tell you to Mr. Eric, okay, they have this right here. A lot of time, if it's in the back, it's the shoulder, right? It's going to be the chest area that needs to be strengthened. You do the balancing, you do the whole approach with the nerve, the muscles, and the tension, you're going to see some good results as far as getting rid of the nerve pain, all right? Or the shoulder pain. Anybody got any questions about shoulder pain? Okay, there's some more to follow, and if you got questions later, I'll be happy to have them.
All right, so hi, I'm Jackie, and my approach to pain. So first and foremost, I'm gonna I'll do the scale of, let's see, WMM. So I'm going to be taking this on, which is hip flexors, and I'm gonna do WMM, which is what matters most. So that's going to be the what and the why and the how. So for me, I work more as a structural manual therapist. So meaning I take your body and do more of my physical assessment, but listening first and foremost, not just based on the actual work or actually what one has told me from the team. I'm gonna still ask you, how are you today? Where are you at today? Is there a primary something sticking out? Well, why I do that is because even though I'm talking about hip flexors, sometimes it can be another connection that caused that for the hip flexors. A lot of times hip flexors, could I have a volunteer? Hi, you.
Push hard.
Right. All right, so, and the reason I brought her up here is because even though we will be addressing later following me, pelvic floor dysfunction, it still ties in with hip flexors. But the reason I brought her here, you can sit down, is that the what? The what is that we have two components in the hip flexor. So hip flexor, the main are what we call our psoas muscle. And that is so actually your psoas and your iliacus. So I'm gonna have you stand up for me now. So psoas and iliacus. So psoas really is in the front here. So, okay, can we go to the last slide? Well, iliacus is right up at the top here. So it technically runs from here and it wraps around all the way to the back here. So psoas, I like to do my psoas work from the back. And the reason I do that is because a lot of times people can't handle work from the direct tender area. And a lot of times I'll check in with you, but I always ask for permission.
Sure.
So, because a lot of times it's a personal area. So our psoas and our iliacus are our stabilizers. So those support our pelvis and the spine. And that helps with us being able to kick, us being able to walk, us being able to stand, because it's the support for the lumbar, the back. So with the muscle being so deep, it works better for me to do the approach from more so the back side, because with the connection of the iliacus running from front all the way to the back, the muscles tie in together and it runs along the lumbar spine. So with that being the case, now I want to talk about what could cause pain. And with the function, sometimes we don't realize sitting. So when you sit for long periods of time in a day, most people, we sit a lot. Your muscles shorten. So when the muscles are short, that contraction, it allows the muscles to not have that same form of movement because it has no elongation space. So within that, we'll take the work that I do, I'll take and I'll address from the front to the back. But generally, you're going to be more so in a face down position, and I'm going to address from back to front. But the key thing is, I don't always address it that way. I'm address sometimes front and back at the same time. So with that being said, I'm going to have her lie down, face in the face down position. So when I work like this, a lot of times we will have, when you have pain, there are 3 trigger point spots, and there are main trigger point spots that will always show up a majority of the time. And that's a little bit different from what we see here on this picture, because a lot of times it'll be from the back, and then you'll have one in the front, and then you'll have one right here at the top of the thigh. And the reason that being a lot of times, because the muscles of psoas and iliacus, they allow us a lot of hip flexion movement. So with that being the case, a lot of times people are tight right along in this area between 1 and L5 of the lumbar. Reason working that is because you want to open up all this that wraps around into the front here. So by the time I get to the front, I can have you now go face up for me. And this will be the how I address this. So I'll stand this way. So being that wraps from the back to the front, generally the pain, most people will have tension here. Sometimes it radiates to the knee. but generally you'll feel it first in the back. Most of the time, my lower back hurts. This is why, because the muscles have tightened in between with your iliacus and the psoas. Psoas is really in the front here, but it's such a deep muscle. This is very tender and painful. So I like to address this way. Sometimes if I have to modify in the event that someone cannot move a certain way or be in a certain position for a certain amount of time, I may sideline you. I may just take and have you be face up. You stay right there. And I will you raise at the knee here. So due to this being a personal area, I'm just asking for permission to work that.
Okay.
All right. So what I would do is I would do more of an internal rotation that shortens the muscle, and that allows me to find the iliacus, and then you also have an iliopsoas tendon, because hip flexors are generally the general term that most people know. It's common, but technically it's called iliopsoas because of the two connected together. You have tendons that run along that connect right into this area, which is your pubic line. So it lines right medially, right along there. And then you have attachments of your ligament. It's an inguinal ligament that's more so in the groin area. That's why that spot's there. But majority of the time, you will have it where you'll have tension here. And most people say, well, I don't feel it there. I feel it on the outside. Reason you feel it on the outside is because you're having a trigger point in that area. It rotates and it shoots into that area of. So what I will do is I want to show you pretty much, but I'm going to just kind of modify this because it's probably hard for you to see how I would do that. But I would find and locate with her having it shortened. So iliacus. So most of the time it's stuck. So when we're stuck like this, it limits the range of motion. It limits movement. A lot of times people don't realize why they can't cross their legs, why they can't lift their legs, why they can't do an internal rotation, because everything is really inhibiting movement. So what I would do is go in and release. But I would gently find that. I would check in with her. Okay, and I will cup and more so continue the rotation movement. And the more that I continue to do internal rotation, that allows me to feel the easing and the muscle releasing on its own. Now, technically, sometimes, a lot of times people don't realize it's not always coming from here. So that's why I stated that I work from front to back, and I do it pretty much sometimes at the same time. So your hamstrings may be involved. So I will go into your hamstrings, and I will also work iliacus, and I will also have hip range of motion. So I will have hip, iliacus, and hamstring. And I would gently work those and allow rotation each time that I'm doing a movement, and that would allow releasing. And then you will feel the easing of the muscles start to relax, because when it's contracted, that allows for relaxing of the muscles, and that takes away and eases off the pain. And a lot of times we don't realize that sitting in a state, one position all day, has the effects that we receive, and it layers every day. And then we don't realize it. And a lot of people think, well, this just showed up today. No, it didn't. That showed up, that was there 20 years ago when you were working somewhere and you were in a sitting position all the time. So when those types of situations come up, I like to explain that this was layered. And it didn't just happen today. It showed up today because it became an onset because your trigger points showed up and then caused this pain to react, and then you felt it. So now you're here for us to work it. And that's what we'll do. And that's how I approach it. And that's information about psoas and iliacus, which is the term Iliopsoas. So hopefully you can come see us at Living Well Balanced and we can take care of you from there and you'll walk away feeling better.
All right.
Yeah.
Give it up for Jackie.
Tyson's back.
No, I
You told me to say.
such talent.
But I said I want, I said I want.
For now.
You moved like it.
Yeah, true.
Yeah.
So I'm gonna feed off of Jackie. We decided, all right, we can take the lumbo-pelvic hip complex together in that dysfunction. And I love that she used sitting, because that was actually one of the main things I wanted to speak about. The word posture, we just assumed, all right, having an aligned spine. The root word of posture is actually position in Greek. And so it's the positions that we're in that our body takes on and starts to form that as a hazard. And so if we're in a seated position, we can either dump out like this, which no one likes. Everyone's going to tell you, hey, pull your shoulders back, get up. And you're immediately going to do this.
Relax.
Yeah. You're going to try to stay upright, and that's your body's attempt to stay organized and aligned. The difference is when we stand up and we try to stay in this position, we have the support of our glutes, we have the support of our core, because we have the ground giving us counterforce. When we're in this position, our glutes turn off. We can't really use them unless you are very concentrated, and you're only going to be able to hold that for so long. And so what happens is, like Jackie says, these hip flexor muscles, the psoas muscles, the quadricep muscles of the rectus femoris start to shorten and become overactive. And that can cause a host of problems. It can cause restricted breathing. It could cause us to have lack of extension at the hip. It can have us walk with our feet turned out, because if we're getting this much pulling through the psoas and not enough engagement in our external rotators, because like Jackie says, we're stuck in an internally rotated position. We don't have access to our ability to externally rotate. Then we're going to have compression coming down the inner thigh to where our femur kind of collapses in. All right, and then this sends way too much pressure to the knees. And because my femur is turning in because of this seated dysfunctional position, then my feet are going to try to compensate, tibias are going to try to compensate by turning externally. So if you squat and you're out with your feet turned out, that might feel more comfortable than with it straight. But if I came and pushed you, you wouldn't be as rooted as if your feet were forward and your hips were able to externally rotate and open up. And so what's happening from the movement standpoint when people are squatting, when they're hinging, and you're trying to get them to full range of motion, is that when they try to get their torso through, they need a block. In comes my hips. Too much of this is happening, boom, I can't get any farther than this. And let's say, all right, I want to pick something up. I want to hinge to pick something up and protect myself. They're just going to turn their spine because they can't actually get through to be able to pick something up, engage the glutes, and come up. So it's really these positions that we put ourselves in that are comfortable, which, being comfortable is great, but if we're not challenging our natural positions, a host of dysfunctions are going to come towards the bottom. Our lower back is going to be forced to be doing way too much, and that's where you get the disc bulging and then lower back pain. I have clients tell me that when they're sitting, they feel okay, but then when they stand, they get this like piercing back pain. That's because they're finally actually loading their whole system. And so the lower back is like, whoa, I'm not used to my entire weight. I'm not used to having to support my entire upper body with just my lower back. My glutes should be able to do that job. So I want to take one volunteer just to see how they move. And if not, I'm going to be like Jackie and pick somebody. I'm going to pick that gentleman over there. I don't want to pick on you.
Now I'm pushing.
Yeah, right?
Nice to meet you.
What's your name?
Nick.
Nick.
Nice to meet you.
So I'm just going to have Nick do a quick squat
Yep.
assessment. Let's do 5.
Okay. A little exercise.
I can't do that.
And now let's hold it at the bottom.
Hold it here.
Yep.
After.
Right up bottom. Yep. And hold. So, and not to pick on you, because I can guarantee you mine is worse than yours. I'm obsessed with this. I'm trying to fix my own dysfunction. The heels slightly come up, and if, let's say if you're in this position, right, and you're not using your glutes, everything's pulling up, you're going to become dominant in your quads, and your hamstrings down to your calves are going to shorten. So that when you want to get to that position, the heels, if they want to stay there, are going to have to come up to be able to let you just be in this position. The other thing we
I
notice
want to do that.
is the collapse.
That's a low squat. He's holding.
I know, don't get me wrong. Look,
Yeah.
he's not bad at all.
He's good. It's full. Yeah. Yeah. Yeah.
Okay, fine. So if you notice the knees come in, right? So that's the pulling that we're talking about. So what we want to do to counteract this, obviously, Jackie takes it from a mom. Yeah, you good.
You have to pull me up.
That'll be my first exercise for the day. So
I want to get you in a proper position.
no, right. I thought you were maybe going to show me that. So I was like, all right, I'll stay, hang out.
So Jackie works on the soft tissue. He gets deep in there. And what we focus on as corrective exercise specialists is to give you movement principles to be able to allow you to stay in those positions and not get too locked up and have your body just trust in, okay, this is what's safe, this is what's okay. So we'll have you either do things like a squat if you're capable of doing it and just practicing that position, or teach you certain principles. One of the principles I've been teaching people is that they have to sit at a desk all day to get up every now and then and just do this. Open up the external rotators. Or if that's too high,
Maybe not for the class.
putting the leg over the other and trying to get more rotation. Because this through here blocks the ability of the hip to rotate. That's why when you get down to a squat and you feel like you can't get through, like you hit a block, it's because you're not able to, you don't have access to that range of motion that hip socket offers. And so we try to get people to spend time in that position, give them principles of how to rotate the hip, open it up. And I'm actually going to call on you again.
Again.
Yeah.
One more time. Sure. No problem.
Now you get the relief.
So one thing I might have him do in this room, if you
Lay
go face up.
Face up.
Face up, yeah. So one thing I might have him do in this room, whereas Jackie might manipulate the muscle, I'll take it through its range of motion, back and forth. Which see, he's got decent hip rotation
For this year.
for this year. Right? So he can rotate it well on either side. So I'm already telling that the only reason that your hips came in is probably due to a imbalance in the length tension relationships. And by that, I'm going to piggyback off Lance. Everything, there's an agonist and the antagonist. And so that agonist muscle needs to be the right muscle. If you squat and everything comes in, the agonist muscle isn't going to be the quadriceps and the glutes. It's going to turn into the inner thigh and the low back. And so what we would want to do is start to wake up these muscles. Not necessarily pound those muscles and get them enormous, just wake them up and get them to understand their job. So I might have him get it on the floor
Back again.
and get in a quadruped
Oh,
position.
no.
Like this.
So on your hands,
Yep.
and then open up your knees slightly,
Like a downward dog.
just right here in this position. So open up your knees slightly, and I'm just gonna have him pick up his knee, keep his foot straight and just fan that leg out as much as he can.
Oh, wow.
See what happens here is this external rotator here gets some activation. And so if you're good.
Yep.
And so if we know anything about, thank you again.
You're welcome.
So like I was mentioning, if this hip is external rotating, we lose access to the musculature of the glutes. And so we want to work in conjunction with Jackie, lengthen those muscles, and then work on activation. And then another thing I like to preach is just spend time at the end range of your position. So if you can get to your deepest squat and hold that, like I was having him do for forever, that'll help your body realize, okay, this is a safe position. And if that's not accessible, going up against the wall, sliding your glutes all the way towards that wall and trying to mimic a squat position against the wall and just holding that passively and trying to breathe through and get your body comfortable. Just being in that position to where your hips externally rotate, open up, and the torso can come through the body. So that's what we do in this room. Does anybody have any questions?
Yeah, do you find that it happens with men deal with tightness more than women, or it really just depends on what their lifestyle is like, regardless of gender or sexuality? Like if they're, someone that does
That's a good
athletic
question.
stuff versus someone that's sitting all day,
So I find that to be more so the case with people that sit all day and are weekend warriors.
Sure.
They spend 8 hours in the office and then they kick it for an hour at the gym, or they kick it at whatever camp they go to, and then they're like, all right, I got my workout in, but still they're promoting these same positions. So that position isn't really getting, sent, like it's not sending messages to the brain like, hey, like this isn't a position I want to be in. That squat position might be a position I want to be in. And then they go into these classes and then they do like heavy squats or heavy weight training, and then they're having dysfunction and then strengthening that dysfunction. So that's what I see is most common. And then, going on to Lance, like this is going to go through the whole chain. So we see people that have lumbo-pelvic hip problems, have knee pain, but also tight shoulders.
Yeah, right.
And like bad ranges of motion or not good rotation of the arms. I think Eric had something to add to that.
Well, I was saying that's a great question. I'm a big advocate for teaching people that the human movement system is equal, right? And what I mean is that from the time that we are a toddler and we learn how to crawl and we learn how to walk, right? Every time that we make a new milestone in the development of our growth, right? It doesn't really matter if it's male or female. It's the job that we have done. It's the thing that we have fell in love with or created from our daily routine that actually caused that dysfunction. I'm a big advocate of teaching people breathing and accessing certain muscles of the pelvic floor, the glute, right? Things of that nature. As much as a woman should squat, a man should squat, right? As much as you should take the stairs, right? My mom should take the stairs. Like it's always going to be something about movement in the human system that's going to actually have a chance to give you an equal playing field. So like I say, great question, but I always try to make sure people put themselves in the mindset is that it doesn't matter male or female. The human movement system is going to move ideally the same.
How about age?
So again, it goes back to the thing of position. I'll give you an example of the grandmaster of my Kung Fu system. If I were to show you a video of him, you would say age doesn't matter at all. Because from age 6, he has practiced intensely, rigorously Kung Fu. And so at age 83, he tends to his garden in a full squat like a child would look at a toy that is interested in. And so he moves like a cat. Now he's not as fast, his fast twitch muscle fibers, he doesn't jump as high. That just comes with the muscles degenerating naturally over time. His, peak, let's say musculature is going to happen around 20 to 35 to 40. So while age has a factor in the sense that like things will start to degenerate slowly, it's more to do with how have you moved your whole life. Like, well, what were you doing from age 10 to 70? And that's going to compound on how you feel at age 70. Jackie says that they're asking like, how did I get this way? And she's like, this has been a long time coming. And I like to think of it as a slow motion injury. Think about an injury that took 50 years to come to fruition. So while age does have a small factor, it's still what kind of positions has your body taken or started to adapt to over time, and how much does that adaptation that your body's doing to help itself actually serve you. So, any
Age doesn't
questions?
equal pain.
That's the
Age
next
doesn't
workshop.
equal pain. Excuse me. Age doesn't equal pain. Right? On your next birthday, if you wake up in pain, something's wrong. It's not because it's your birthday. Right? Something happened to get there.
Oh, yes, it
Right?
will.
Something happened to get there.
I'll
Right?
let you get my age then.
So what is something that, and you all know how old we are, something that Ron and I can do to relieve some of the back pain? Because I know I walk every day and I know I probably don't walk properly because you're helping me with that. But what is something that we can actually do to relieve the lower back pain? I know buying new bed and all that, but before that.
So something as simple as that's why I refer to us in this room talking about principles. Something as simple as just tugging in the glutes, having extension here,
Okay,
and being just conscious. Like every time you're aware, oh crap, I'm here. Oh crap, I'm here. Those small things will compound over time. Doing small strengthening workouts to activate those muscles help, because then you can actually tug and feel, oh, they engage. I sometimes ask people, hey, squeeze your glutes. And they'll be like, I don't know how to. And so learning simple things like how to stand tall and just kick that leg back and just get small activation
okay,
of that glute
okay.
will make a world of difference in, all right, correct my posture. There, I feel it. Okay, they're slightly engaged. Now you don't want to like tighten up too much. They're slightly engaged. I'm in alignment. I'm in proper position. It would take corrective exercise and massage to, let's say, like relieve it, because again we're talking about 6 years of slow motion injury, so it's not just going to take 6 months to relieve that, but it's those small things that at least lessen the pain or get it to go all together with hard work. So my answer to your question is proper positioning, keeping the pelvis neutral, focusing on keeping the feet straight and rooting yourself to the ground would make a big difference. And also not sitting as much, avoiding it if you can. So, any other questions?
Just want to kind of recap, right? So when we talk about pain as a whole, right? We go down that whole entire cycle, right? Something happened yesterday, something happened a year ago, something happened 5 years ago, right? It's not that when we have an injury or a signal happen that immediately we go into, well, let me just rest in ice, right? I'm all about ice, heat, whatever myofascial, thing that you need. But the biggest part is that being able to recognize what we actually have done to our body, right? Whether it is something from an occupation, right? If you're going to have a pain here and we know that it came from your job, right? You're not going to quit your job, right? That's nonsense. Right? You're not going to quit your job. You're simply going to find out what path we took to do our job incorrectly for our own body's sake. So going through, this workshop, I wanted a chance to address some common pain points, right? So what I left in this open space, right? These tables are actually here for a reason, right? So today I want you to be able, whether it is literally 3 to 5 minutes, I want you to be able to ask us questions. You have some of the smartest people that I've come across in the past 10 years of doing this, to be able to actually ask those questions, whether we put our hands on you or simply ask that question. But we literally brought these 2 tables out because I want to be able to actually kind of have you address some of those things tonight to change your thinking of some of the pains that we're feeling. Okay? All right, so Lance,
The whole panel.
Jackie, the whole panel, come on in. All right. So who's the brave soul? One, since we have 2 tables, one, I wanted someone to be able to actually take the time to step right on up. But also while people are getting worked on, please don't feel the need to sit down. I want you to see, what your peers are experiencing, what they feel, on a normal day. Sometimes we hear someone else's pain and it's a recognition like, man, I did feel that. I happened to actually feel that 2 weeks ago, right? You're not alone in these human feelings and human pains, all right? So who's first?
On that, I do have something. So part of the reason I'm here, I'm 34 years old in June. Last summer, the end of last summer, I caught COVID. It was a pretty bad strain. What was worse, though, was that after I healed from COVID, after about 2.5 weeks, I had a slight case of myocarditis. So I had a lot of abnormal blood flow that stuck with me for another month or so. And about 2 weeks into having that, so 2 weeks healed from COVID, so to speak, I stood up from sitting, or I was laying on the couch. I was reading this stuff about gardening on the phone. I was laying for a while, probably 2-3 hours. And it was during the day. I didn't just wake up. I was reading, right? I was just relaxed state. I stand up to go get a drink, and the blood flow is really slow to get to my head. So I go walking toward the kitchen. Luckily, there was carpet under me. And it's happened when I've given blood before for maybe a minute, 30 seconds, right? And this was different. This was more intense. And so I fell straight down onto my face. I lost all movement in my legs. I'm 33 years old at the time. I lost the ability to my muscles to hold my body up, and I collapsed and I landed on my shoulder. That's just one side of it. What's been more concerning, and part of the reason I came to Living Well Balanced last fall for cryo, was because the healing in this shoulder I landed this way, right? So I landed, I pulled this area. I don't think I necessarily tore it. I think I stretched out these connective tissue that connect to the rotator cuff area.
Yeah.
But it has been 7 months now. And I am to the point where I would say I'm about 85-90% healed. So I still, 7 months later, feel a 10% pain.
Yeah.
Right. But the first 2-3 months, 4 months, it was 60% pain, 50% pain, 40%. It is a very slow healing process.
Yeah.
And I've done cryotherapy here a number of times at the Restore Hyper Wellness in downtown Raleigh. I've done heat infrared therapy, sauna therapy. I've taken certain nutritional supplements like glucosamine. I've gotten about 5 IV shots, usually 1 a month for the last few months. I was able to afford it, which I was fortunate to do. But even doing all of that, and I did a little Taekwondo last fall, which is mostly lower body workouts. It was beginner, right? So it wasn't super intense on this part of the upper body. But even with all of that, I have still had 7 months to get to a place where I feel like I can lift big weight over my head and I can do things that I was normally able to do just fine last summer and before at 34. And so this has been really enlightening because it seems really shocking to me that it would take so long to heal. Yeah, I'm not the strongest athletic type, but I'm also not I haven't aged too much yet that it should take that long. And it was a little concerning to me that it's been such a long healing process. And I eat pretty well. I don't, I exercise somewhat, like I mentioned. I'm not living a really unhealthy life. I don't smoke or anything like that. I don't drink. I haven't drank alcohol really at all in the last 6 months. So I'm not really sure why it's taken the body so long. Could be some after effects of getting sick that's made my body just naturally weaker than it used to be. Or it could be other things that I'm not aware of, things I could do, nutrients I could take in that I'm not. And so those are some things I've been curious about.
Okay. Do you mind taking my seat?
Yeah, sure.
Okay. I love this stuff.
Yeah.
All right. So I can't. So I was going to answer this question, but he deserves more than that, right? So right left.
It's the injuries here left.
Okay. So let's go down the rabbit hole.
All right.
Right. So.
Yeah, sure.
Eric, do you want to switch sides and spaces?
Yes, please.
Oh, sure. With the light. Yeah.
Thanks. Okay. All right. So I want to go down the path. One, you had mentioned right? The steps of where you got to finally fall, right?
Mhm.
So it's not your fault that you fell. Right? It's not the COVID's fault that you fell. Right? It was the situation that happened.
Sure, yeah.
Right? So what you experienced was trauma.
Yeah.
Right? To the body. Right? And the first thing that I heard you say was the lane, right? What we took, things of that nature, right? A lot of passive interactions, right? So do me a favor, give me a thumbs up.
Okay, with this hand.
Yep, yes, sir. All right, I want you to take that thumb, I want you to extend that for me.
Yep.
All right, take a deep breath, put your shoulder back.
This shoulder back.
Yep, right
this?
there. There we go. Right. So first things first, when you felt what you just did, you notice the path that you had to take to get there.
Yeah.
Right. So let's go back down. Got the photographic memory.
Sure.
Right. So I want you to take a nice deep breath.
Yep.
I want you to bring your shoulder forward.
Yep.
I want you to bring your thumb down.
Yep.
I want you to pull back.
Yep.
Right. And then that's right.
Yep.
Right. So if we had spent so much time, right, going through trauma, laying down to rest, right, then experiencing that pain, then trying to find another thing to rest, then we get inside the cryo, and then we find another thing to rest,
Yeah.
right? So what happens is that our body needed motor learning to understand, okay, I experienced this, A, B, and C is hurt. Now that that's not hurting, how do I get it to actually functionally give me what I need? Right? So the first thing that I had noticed, when you had stood up was a slight rounded in the shoulder.
Sure.
Right? So if we go from a passive standpoint, the fact remains that even though that you experienced trauma right here,
Yeah. And
Right.
here. Yeah.
right? As soon as you allow that trauma to accept defeat, right? That's when we started developing what's going wrong,
Interesting.
right?
Yeah.
So if we go through go through the process of, all right, what is injured, what is out of alignment, what is not responding the way I would need to, and what's not giving me the push and pull that I need, right? Because one, you got good muscle tissue, right?
Mhm.
The moment that you took a deep breath and I told you to pull your shoulders back, you showed me that you didn't address the posture,
Mhm.
right? It's just that now your body has now come over the milestone of I am no longer damaged, right? Now we got to actually tell our body, hey, you can do these motions, right? Do me a favor, grab my hand.
Yeah.
I want you to chest up.
Yep.
Right, and pull it towards me.
Towards you this way.
Through your body. Yep.
My body this way.
Mm-hmm. So you feel how you just push that muscle towards me.
Yep.
I started leaning.
Yep.
Now I want you to go to the middle.
Yep.
Right. Take a deep breath. And now I want you to pull my arm towards you.
Pull this one
Mhm.
back like this.
There we go. Right. So all I did was just make you address this muscle right here.
Yeah.
So one, if we worked on this muscle, in fact, it'll help that postural alignment, get that shoulder to actually drop back for us, and then we can address the motion that's been affected by it. So the pain that you're possibly feeling is no longer passive. It's a call to action. Okay. I want to perform the things that I used to be able to perform.
Mhm.
Right. That's the biggest thing that we want to do. Right. So if we're here, there's any pain pulling.
From my end?
Mhm.
No, not in this. Not pulling this direction. No.
Hand up, chest up.
This hand?
Boom, push me.
Nope.
Any pain pushing.
Nope, not there.
Right. So that's now the body is saying, hey, I'm ready to do what it is to address this.
Okay.
Okay. So let's think about going about this in an active way. And now you have graduated from a passive way. That last 10% is your body asking, hey, I need to do something now.
Okay. Yeah, I see what you're saying.
Right.
Yeah, yeah.
Right.
yeah.
I've been suffering for a while. Now I need this from you. That's the brain telling the areas, this doesn't feel good.
Yeah.
And it's because I don't move like I used to move.
Mhm.
Okay.
Yeah. Cool. Appreciate you.
He's looking at you.
Pointing at me.
Huh?
I mean, Ish hasn't been here a while.
Yeah,
He's
that's
got
2
something
years.
to talk about.
Yeah.
I can't lie down on that table without hurting like hell.
Which
So I'm
position?
not gonna come down there.
Which way? Because it modifies.
Both
Like
ways.
that modifies,
This
man.
way.
Come on now.
Exactly. I can't lie down.
Can you sit
I
up?
can't get, yeah, I can
Oh, God.
sit up, no
Yeah.
problem. I can get up
Is there
slowly.
anything you want him to look at?
Sure, why not? Very dark feet.
Right behind you.
Oh, he's
Hey,
holding
my
me down.
adult supervision is here.
I'll get up. won't hurt.
Yeah.
Because I got up slowly.
Mhm.
I may fall down, but
Mhm.
that's a different point because there are plenty of people. in the
Absolutely, absolutely. We all aware.
No, I am not gonna fall down today.
Yes, sir. Yes, sir. Actually, all I want to do is just watch you walk towards me. We're gonna take this way.
This way.
There you go. Yep.
Go down, kid. I just remember, I'm only 80 years old.
You're so young.
Yeah, that's right.
80. Good
Yeah.
grief.
Yeah.
Well, talk to me when you're 102.
I ain't gonna say that.
Yeah, I want you to have a seat for me real quick.
You want me to take this?
Mhm. I got it.
You just sit right there.
All right. So,
I can sit down, all right?
Mhm.
Okay.
there we go.
I did that this morning with the doctor.
Tell me what you've been. Tell me what you have been experiencing and how you kind of met Dr. Pitts.
See, that's because his father is my friend.
Ah!
And his mother is better friend. I keep this facts as they've come. You know?
Absolutely.
And we live close.
Yeah, they were the first person we met.
Right.
So,
in
how
our
did I say?
neighborhood.
As long as I walk slowly now, I'm okay. But you will walk over to the end of the street 3 years sooner than I will.
Gotcha.
It's so slow.
Gotcha.
And then I'll hurt the legs. I had to sit down
When did this start?
24 hours a day.
This is constant.
This is continuous, not constant. It goes up and down, but it's continuous.
We'll have a Josh conversation. So. Right. I'm
It's his problem.
I'm a lower you a little bit more. Okay.
I couldn't get the X-ray done because I couldn't stay on the table.
There we go.
Yeah, too
Right.
excruciating.
If you can point to 3 points of pain, where do they come the most?
Whole area.
Mhm.
And of course, this is a continuous problem. But then with the injections, it's holding pretty well. And this is unrelated, but this is still after surgery, still there is a neck problem.
Right.
C5, C6.
There we go.
This one is S5L1. That's been a problem for last 5-6 years.
There it is.
And it's not changing on MRI at all.
Right. So I saw movement. Right when we walked up.
I can't run like I used to.
Right, and it's not necessarily the speed, right, that I'm automatically looking at. What I've looked at is the
It's a
functionality,
wobbling situation.
right? The function. I like to call it the duck waddle. All
I
right,
have no idea what
or
you call it.
safety walking, right?
All right.
So if we're dealing with lower back pain, take a deep breath for me. There we go. Exhale. Again. There we go. Exhale. And one more. There we go. And watch. So if you notice when he took a deep breath, what did you see happen on his body?
Only his upper body.
Right.
What did you say?
Only the upper body moved. Right. So when we're dealing with a lot of pain, when we're dealing, because one thing I couldn't help but ignore, I could not ignore was the fact that you said this is unrelated, right? But it's not. Right. This is where you're holding all the extra tension. This is where you're holding a lot of the trigger
I have no
and that's
tension.
pain reception, right? So the moment that you took a deep breath and I saw this happen, and I know that we're taking improper breaths.
If you say so, sir.
Yes, sir. All right. So what I want you to do, I want you to pull your shoulders back from me,
This way?
towards me. There you go, right there. Deep breath. Exhale.
That hurts.
I don't know. Right,
I didn't come here for games.
Hey, don't put that on me, man.
Your next
Right?
promotioning.
So right there, right? This
You
spot.
know, right now,
Mhm.
the pain is more on this side.
Mm-hmm.
It moves from side to side. I have no idea why.
Yeah.
And actually, I'm in better shape today than I was yesterday.
Yeah. So when we mentioned muscle imbalance, right? This started with the pain, right? It started seizing, it started tremoring, things of that nature, we started changing our walk.
I forgot to tell you one thing.
What's that?
3 weeks ago, I fell down.
You're trying to set me up for failure. That's all that is.
No, I forgot. Old people don't have memories.
All right, so let's talk about
Be careful.
right there. Yeah. So when it comes to pain, pain has a way of showing up in one famous spot, but actually
Right there.
deriving from several places, right? So you saw where I started and now where my hand actually is.
Mhm.
So right there. So what's happening is a movement dysfunction that's starting from the feet that's actually trickling its way up to the glutes, right? With underactive glutes, you're going to have a couple of compensations happen, right? So if you notice this muscle right here and the lower back, take a deep breath for me. There we go. All right. So you notice at the top of the glute, that still has a connection right there.
But it doesn't hurt.
Right. And that's not supposed to, right?
Oh, okay.
This is underactive right now, and this is taking over, right? So what we have is a muscle imbalance of
Everything
functionality.
Everything goes down the legs
Mhm.
also. And if you can get another item,
Mhm.
see water is holding in my legs.
Yep.
And that has returned in the last 5-6 days.
Eric, are you talking trigger points when you're talking movement?
Right. So trigger points are just little signal spots, right? So right now, this is like the perfect example, right? Because if you notice the chain, right? If we look at a muscle imbalance from a checkpoint stance, if we're standing, we should see our hip, knee, and ankle go in the same line, right? And what happens when we have something going on with the feet, we have something going on with the inner hip, we have something going on with the glute complex, just like Yadam was mentioning, is that what tends to happen is that we go from an upright, comfortable position where this feels good, and we can go when we're ready to move as soon as we can, right? So we finally go into safety mode, right? So the moment that happens, I create a tension that will also allow that to happen, right? And what that does is put a tremendous amount of pressure right alongside there.
I sleep well with the pain, no problem.
You're a strong man. I
No
gotta tell
problem,
you,
honestly.
when I felt this spot, I immediately thought, can he please get scheduled with me?
When was the last time you had a massage?
Monday,
Oh, yeah, that's right.
Okay.
every week.
Yeah.
But not here anymore.
You feel the same tissue right here? Just right there on that side. You need
Happens,
Yeah.
Mhm.
Jackie's a lovely massage therapist. Yeah. So right now we're dealing with literally one of like the biggest combos
That's
that
like-
we need to address, right? So-
Everybody come on work.
I got hand sanitizer and massage lotion everywhere. All right. But what you're seeing in the collaboration of why we love working with Dr. P, because he's dealing with an alignment issue, he's dealing with a tissue issue, he's dealing with a nerve issue, and dealing with a muscle imbalance, right? So the pain that causes us to continuously tense up, right? The sensory reception of not feeling the way we are activating and telling the muscles what to switch on,
You can find the problem.
and then being in pain and losing muscle because we no longer are moving the same, right? So it didn't happen overnight. It had to follow a path, right? And you can see that it's moving from the feet right to that's our back and forth, right? So now we end up playing the game of this side, this side, this side, this side. I can no longer stand, and now we're locked up, right? So how we would approach this is an alignment and adjustment from Dr. P, soft tissue work from our massage therapist, and then graduating to what it is that we actually do into this rehab motion, so we can actually create a little bit more of a recreating or relearning how we're supposed to move. Right, this is literally one of the best examples. Like I really appreciate you like talking to us like this. Yeah.
I do have a quick question about gentleman, if you don't mind me asking about his situation. Let's say he was to walk maybe an extra half an hour every day on his own.
No
but
way.
that's before. I understand. That's a big ask. But if he was to do that before coming in here for alignment, before coming in for proper positioning, right? We spoke earlier. A gentleman was speaking about with me up there about how, hey, if you do things in the incorrect way, right, then you just add to the incorrect, right? So like, could that perhaps make things worse, right? If you're already walking with like an imbalance, right?
Correct.
Doing it too much, it's going to make it worse, perhaps. Yeah.
Correct. Right. Think about think about exercise as a whole. Right. One, I tell as many practice members that will listen, I tell them to walk all the time. Sure. At least 3 days a week. Right. Because you're able to feel proprioception. It's just a fancy word of your feet can feel what the elements are on the ground for you to activate muscles that you need.
I do stationary bike about 15 minutes 3 times a week.
Okay.
But walking, I get out of my garage and the second house, I gotta sit down. I can't handle it.
Can I add a tip to that?
Oh, I'm sorry, behind the
No,
back.
you're fine. So, I wanted to throw a tip in there for you too. I see that you carry your wallet in your back pocket.
That's because I don't want my money to go away.
Front pocket.
But if you transfer
Right in
that-
front pocket.
No, actually, most of the time it's on my desk.
Okay, oh,
Right, yeah. Anytime you
And
get
on the
wallet,
drive, I don't do that because
okay, great.
that's been pointed out about 8-10 years ago.
Gotcha.
Yeah, I agree with that because that can create some issues.
Yeah, but the short answer to your question, right? Being able to walk on a normal basis is one of the greatest foundations of kind of starting your exercise, because your body needs that feedback. It needs to know the difference between asphalt, turf, grass, gravel, right? Concrete. Those feedback that we get, right? That tells us, all right, flex your quad here, flex your glute here, flex your hamstring there, stand this way, right? We can get all the feedback we need almost from walking on a normal basis. When that starts to get taken away from us, right? It's like, oh, I twisted my ankle. Oh, I broke my toe. Oh, my knee is hurting, right? And we just shut it off. And then we start to actually let that stuff sit in. And it's hard to go back from there.
You want to hear some more complications?
Yeah, golly. I want him on my schedule immediately.
I have a new heart valve also.
Oh, man.
And I made you walk?
No, that's fine.
Okay. I was about to say, you got no medicine that you have now.
Carry me around.
Right?
No, I'll walk.
Yeah.
I generally end up walking about 1,500 feet a day around the house and just a block away.
Yeah.
But what do I tell you guys? It's against my religion.
All right. So I want you to actually be on my schedule as soon as possible.
You don't have a schedule that I know.
Well, I'm gonna give it to you.
Okay, can I go now?
Yes, sir. Yes, sir. Thank you.
So with him, if he was a new client, I mean, I don't know if he's.
I'm an old client, believe me.
It's like, what do you think we could do with him in 3 months? I'd like to see him walking without pain in 3 months. It's possible, and then maintain it.
Eric,
If you
there's one thing here.
We'll do the dragging. And then we will.
You
decide.
gotta have goals. Gotta have health goals.
Right.
You don't come here just to take up space. We gotta see progress.
Sure.
Eric,
One more
the
question.
one thing here, everybody here is here for one reason. Doesn't matter which one of you work on it. You're here for one reason. That's to make us better.
Yes, sir.
And we know that when we walk in here.
Thank
Because of the friendship and the love and the affection that's shown by all these people.
I need you to.
You don't
record
find
that.
it.
I need you to record that.
Get that on
Thank you. Thank you. All right.
But that's part of your healing.
Yeah.
That's part of your ministry, your healing.
Absolutely. Thank you. Well, like I said, I want to thank you all again. What I want to make sure, that we take, from this is it's not taking pain at face value, right? Listen to your body. When something is giving you an alarm, it's a reason, right? Talk to yourself, talk to a professional, right? Go back down the steps. What did I do yesterday? Right? Did I feel like this yesterday? How long did it take to get here? Right? What is something that I used to do that I feel like I cannot do now? Right? We want to make sure that we're addressing those things because, like I said, there's times when, yes, pain might make you stop, right? But pain isn't always just a necessary stop sign. Okay?
Wonderful.
Thank you.
Good job.
Did you two decide that in 3 months